Welcome back to it, 922.
Did you know September is Gynecological Cancer Awareness Month? That's why Women's Hospital wants women to stay on top of their gynecological health.
There's a lot to look out for, right? But maybe you don't exactly know what to look out for. Tell you what, we should probably talk to somebody in the know. Gynecologic oncologist Dr. Gabrielle Hawkins. Good to see you this morning. How are you?
I'm doing well. Thank you guys for having us on.
I can't say thank you enough, especially during this month. I mean, every month, but this month. And we're going to talk about some of the statistics here in a minute. But when we talk about gynecological cancers, it's a wide. What are we talking about?
Yeah, it's a great question, a great place to start as well. So we're talking about cancers that start in the ovary, cancers that start in the uterus or the endometrium, which is the lining of the uterus, cancers of the cervix, the vulva, and the vagina.
Okay.
There's a lot to pay attention to.
That encompasses a lot. And I think when a lot of people think, well, it doesn't run in my family, we've never talked about it, surely this can't impact me. But chances are, I'm sure the statistics say otherwise.
Yes. So actually, endometrial cancer is the most common cancer that we take care of in general for GYN cancers. But here in the state of Louisiana, we know that our cervical cancer mortality or death rates are much, much higher than the rest of the country. And with that statistic, Pap smears are really the only screening test that we have for GYN cancers. And so we really want to make sure that patients are keeping that screening test up to date.
You're talking about, and I know, look, as a guy, I stand here and guilty not being proactive enough. So you're talking about being proactive instead of reactive. The sooner you know about these things, the better the chances of catching something and then survivability if it is something serious.
Exactly. Yeah, so like I said, we only have the Pap smear as screening for our GYN cancers. And so the other things to look out for are just symptoms that are often really vague. And so there are things that a lot of women will just kind of think are going on, that they are just experiencing bloating or they're gaining weight. So bloating is something to pay attention to that's persistent and doesn't go away. Feeling full after you eat, having any abnormal bleeding. So abnormal bleeding during, prior to menopause. So you can have bleeding between periods, bleeding after intercourse, but certainly any bleeding after menopause needs to be evaluated.
That's serious. Is there such a thing as too early for a Pap smear?
Yes, so the recommendations are for you to have a Pap smear starting at age 21, but everyone's medical history is unique. So that's why it's really important to talk to your medical provider, because they will help determine the frequency of screening and when it needs to start.
You just said something right there I think is critical. Talk with your medical provider, talk with your doctor, talk with the one that you know, gone to med school, you trust, you understand, the conversation is there, the relationship is there, because at this point there's a lot of advice coming at folks from a lot of different directions. Important to have a conversation with the doctor.
Absolutely.
When we were talking about this just earlier about making sure that you're proactive, women, particularly mothers, I know my wife is like this, she's got a whole house to worry about, kids as well, and so sometimes it's put on the back burner. Don't do this, ladies.
Exactly. And you bring up a really important point, and I always say to our patients that women are often the backbone and cornerstone of our communities, right? We're holding things together, but we can't take care of everyone else if we don't take care of ourselves first. And so it's super, super important to get in there and make sure you're taking care of yourself as well.
To get in there, if women are watching and they say, well, I don't know how do I find you? How do I go to a gynecological provider? What's the first step?
So I think the first step, what I tell most patients is ask your friends, ask your family, who do you go to? Who do you like? Who provides good care for you? Who provides good education for you? And seek out establishing care with that provider. Otherwise, usually Women's Hospital has many gynecologic providers there, and then our subspecialty service of gynecologic oncology is also available by referral if you need to see us. But your regular gynecology provider can do all of your screening and education, right? So those visits are supposed to be preventative visits, and your provider wants to educate you about what to look out for. So they can't do that if you don't go there.
That's the ticket right there. Make the appointment, go talk to your doctor, preventative, not reactive. Thank you so much for being with us this morning. Appreciate your time.
Absolutely. Thank you guys for having us.
Go see Dr. Hawkins at Women's Hospital. We'll see you after the break.